Welcome to the Geneva Healthcare video session on infection control. This video will discuss the causes and types of infection, how infection is spread, how to prevent infection from spreading, the use of personal protective equipment, handling soiled linen, accidents with sharps, splashes and spills, and reporting the risk of infection. What is an infection? Infection occurs when microscopic organisms such as bugs and germs enter the body and multiply, causing the person to become unwell. Infection can be caused by virus, which for example can lead to the flu, fungi, which for example can lead to athlete's foot, bacteria, which for example can lead to stomach aches, and parasites, which for example can lead to head lice. Infection can be spread in the following ways. Direct contact, which is physical contact between people. Indirect contact, which is physical contact with contaminated objects. And airborne, which is infected moisture carried through the air that gets inhaled. A good way of minimalizing infection risk is proper and thorough hand washing, which can be done by wetting your hands with warm water and soap, scrubbing both hands for at least 20 seconds, rinsing your hands, and then drying them with a clean towel. You should wash your hands when starting and finishing work, before and after using gloves, before and after handling food, before and after contact with clients, after contact with bodily fluids, after changing linen, after handling animals, and whenever your hands appear visibly dirty. Personal protective equipment is equipment such as gloves, aprons, and face masks, and are encouraged when carrying out certain home health and personal care tasks with your clients. When handling soiled linen, it is important to wash your hands and put on gloves. Put an apron on if the linen is wet. Fold the linen in on itself when removing it from the bed, and carry the bundle of linen away from your body. You may need a container if the linen is dripping. Don't shake the linen out. Rinse it in cold water and place it in a washing machine for a hot wash, and remove and dispose of the gloves and wash your hands when you are done. Please note, as per Geneva Healthcare's policies, you are only to get involved in blood glucose monitoring and insulin if you have been fully trained and signed off as competent with all relevant clinical cares for a diabetic client. If you are accidentally injured by a used needle, even if only slightly, you must wash the injured site with warm water and soap and then place a plaster over the injury. All risks of infections, incidents, and accidents must be reported by contacting your care coordinator within 24 hours. You may also be asked to fill in an incident report form, which will be sent out to you. Today we have covered the topics of the causes and types of infection, how infection is spread, how to prevent infection from spreading, personal protective equipment, handling soiled linen, accidents with sharps, splashes and spills, and reporting the risk of infection. Thank you for watching.